Modern science has come a long way in terms of genetics and diseases. My name is Kim Ross, and today I'm going to talk to you about pre-implantation genetic diagnosis, or PGD. Why do I want to talk about this topic? I find PGD to be very interesting, and I think we'll be hearing more and more about it in the media as well as the medical world. In this speech, I will discuss with you the what, who, and why of PGD. To begin, let me explain to you what PGD is. PGD is genetic testing involving in vitro fertilization to help avoid genetic birth defects, some of which include sickle cell anemia, Tay-Sachs disease, Down syndrome, hemophilia A, and cystic fibrosis, just to name a few. PGD has been widely used for genetic testing for 17 years now, and it can also be used to help determine the gender of the baby, as well as to help determine the odds of having a baby with a specific hair, eye, or skin color. The process involves using in vitro fertilization to help the doctor select the best embryos and avoid specific defects. IVF, or in vitro fertilization, involves fertilizing an egg in a laboratory dish, then inserting it into the woman's uterus. The cells removed from the in vitro fertilization cycle are tested for abnormal genes, and only the embryos with normal cells are inserted into the woman. PGD is not 100% reliable and only tests for specific birth defects. It is expensive, and it's still considered to be an experimental procedure. Risks of PGD. Embryos may not attach to the uterus when they're implanted, and chances for successful implantation greatly decline in women in their mid-30s and older. Some embryos also may be damaged when removing the cells for PGD testing. Now that you know what PGD is, I'm going to explain to you who the candidates are for PGD. PGD candidates include couples who have a family history of genetic disease. These couples may have been previously discouraged from having children of their own because of the risk of passing on these genetic defects. Women over age 35 are also candidates for PGD. Millions of people in the U.S. who cannot have children due to infertility may rely on in vitro fertilization with PGD to allow for a better survival rate. Now that you understand what PGD is, as well as who the candidates are for PGD, I'm going to explain to you why anyone would want to go through with it. Why would anyone want to go through with PGD? PGD dramatically improves the odds of having a healthy baby without specific genetic disorders. PGD helps prevent the stress and trauma after abnormal prenatal testing, and PGD helps couples to conceive a normal child and avoid the dilemma of possible termination in the event that the child has serious abnormalities. According to the March of Dimes, 1 out of every 100 Americans is born with a serious birth defect. There are over 4,000 known birth defects, and birth defects are the leading cause of death in the first year of life, accounting for more than 1 in 5 infant deaths. To review, you now know what PGD is, who the candidates are for PGD, as well as why anyone would want to consider it. Hopefully now you have a better understanding of PGD and the influence it could have on couples who have genetic disorders, couples who once thought having healthy children of their own was out of the question. Thank you and have a nice day.
Yay!
Thank you, Kim.
Will you be able to take that out of it?
Yeah.
Was that terrible?
I thought
That was